So my name is Eszter and I'm a scientist. There's definitely a lot of differences. So cancer is often thought of as just one disease, but there's actually a lot of differences. So brain cancer may have a very different biology from breast cancer, for example. So we do see that some cancers are very well treatable, like breast cancer. At the moment, patients have quite a good prognosis. But for example, for pancreatic cancer, it's very, very different, and we have very few treatments. So there's definitely large differences there, and there needs to be more research in specifically these cancers that are very difficult to treat. What they do find is that there's people that are obese, for example, that have a lot of overweight, that they have a higher risk of developing certain types of cancer. So generally, we can say, the more healthier you are, if you have a healthy weight, you exercise enough, that reduces your chances of developing cancer. But what people often want to hear is that there's this one food that will prevent cancer or will cure cancer. And unfortunately, it's not that easy. It is in a way, fighting the cells in your own body, because those are the ones that produce cancer. But that does mean that chemotherapy is hard. People lose their hair, they lose their appetite. There's a lot of side effects in other parts of the body. But all of the treatments that are developed have been extensively tested in different models, first in cells, then in animals. Then there's been multiple layers of trials to see whether the medicine itself is safe to people, whether it's more effective than the treatment that we already have. So ultimately, it's all evidence-based, and when people are put on a certain treatment, that is the best treatment for that specific case. But I think often, because it does make people feel very, very ill, there's this idea that you're poisoning your body, which in a way is true, but it's still necessary in order to get rid of these cells that are inside your body. I think the difficulty is that cancer is not one disease. So the biology of breast cancer or prostate cancer or leukemia, they're arising in completely different compartments of the body. The blood cells, they live in a different way than cells that are part of your liver tissue, for example. So you cannot treat these in the same way. Also, the brain, for example, has its own kind of environment, and it's very difficult for drugs, for example, to go to the brain. So you often need to treat that in a completely different way. So it's very likely that some drugs will work on a group of cancers, but will really not work on another one. So there will never be one cure that will help for everything. And I think that's really important to realize.